Good evening. My name is Deron Drumm. I'm opposed to outpatient commitment, aka forced medication, aka forced drugging. I ask that before you consider forcibly treating people, you look at the outcomes of the current mental health system. In my life, in my personal recovery, I've dealt with two different treatment models. I call the first one the medical model, which is what's used in most of America now to treat people in emotional distress. I call the other one the peer model. I suffered emotional distress for most of my childhood. I had extensive routines I went through every day in order to prevent horrible things from happening. For example, if I did not change my clothes repeatedly before school, I feared something bad would happen to my family. I rubbed my tongue against my teeth until I bled daily in elementary school. I was late to high school most days because of my routines. Every time I drove, I thought I hit someone and would circle back multiple times. I know what bullying feels like. I tried to hide in school. I went to school for a total of 19 years and never once raised my hand to voluntarily participate. I was afraid of basically everything. I also felt very real anger. In my late teens, I decided I could not take the suffering anymore. In what was the most courageous moment of my life, I asked for help. I was sent to a psychiatrist whose office was in a medical complex. Above the wing where his office was, there was hung a large sign that read psychiatry. Once inside, and over the next few visits, I was given a diagnosis and told I had a brain disease that resulted in a chemical imbalance. I was given a psych drug regimen and told to set my ambitions in life a little lower. Over the next 14 years, I tried dozens of psych meds and experienced terrible side effects: weight gain, insomnia, sexual side effects. I believed I was less than quote-unquote normal people. I believed I was broken. I simply believed what the mental health system told me. I eventually found my own ways to stop the pain. I found somewhere I belonged, where people were nice to me. I felt like I was someone, where I thought I was good at something. That place was a casino. I became seriously addicted to gambling and destroyed everything in my life, and my worst childhood fears came true. I had hurt people. I ended up in an awful psychiatric hospital where I was given drugs that made me forget who I was. Now, this is the peer model recovery I've gone through. My saint of a mother fought to get me into a rehab facility far away. My first day there, I was approached by a man who said, "Are you ready to start living? Are you ready to take responsibility for your life and deliberately build a new one?" I said, "You don't understand. I did bad things and I deserve to die." He said, "You see this scar on my arm? It was from a police officer tackling him during an armed robbery." He said, "You see the scar on my head? It's where he put a pistol to his head and pulled the trigger." This experience started me on what was an incredible journey. Many peers, people who have had comparable experiences, helped me learn how to live. They taught me to be responsible, not be defensive, not control, not complain, be accountable and reliable. They taught me that I am not broken and that I have value. They also taught me about nutrition, the impact of gluten and processed sugar on emotions. And they taught me about mind and body, yoga, and meditation. The biggest thing is I learned how to feel. I spent years thinking that if I felt anxiety, sadness, guilt, or even happiness, something must be wrong, and I should take a pill or do something else to get rid of the quote-unquote symptom. Now I know that being an emotive human is normal. I am okay having bad days. As my friend tells me, the parade doesn't always have to come to town. I take full responsibility for my life today, but I do have those moments when I think, what if, when I asked for help when I was a teenager, what if they introduced me to a peer that taught me about recovery and holistic wellness, who let me know my feelings were within normal human diversity? I can't go back and undo that. What I can do is fight to change this mental health system. Please truly look at reform. Please do not force treatment as it exists on people. Understanding you will not be helping them, you will be hurting them. The United Nations says if you force meds on people, you are torturing them. Thank you.
Thank you very much. Are there questions or comments? Thank you very much for sharing your story.